Okay, good day guys. Forensic Chemistry and Toxicology Week 3 and Week 4. So we will be discussing about drugs, its definition and classification. So, to start with, ano ba yung ibig sabihin ng drugs? Okay, these are synthetic chemicals used as medicine or in making medicine. So, drugs daw ay synthetic chemical. Pag sinabi nating synthetic chemical, ito yung mga chemicals that are manufactured or processed muna bago maging isang substance. Okay? It affects the body and mind and have potential for abuse. In its criminological meaning, drugs refers to substance. It's either food or water that is intended to be taken or administered for the purpose of altering, sustaining, or controlling recipient's physical, mental, and emotional state. Next, drugs is a substance that brings out physical, physiological, behavioral, and psychological change in a person taking it. So, ang drugs, iba-iba yung epekto sa taong nagtitake nito. Pag sinabi nating physical, yan yung, for example, you are taking dangerous drugs. There are instances na magbabago yung itsura mo. Okay, for example, a person taking shabu. Okay? Ang itsura nila is mapula yung mata. Okay? Or malamlam yung mata, medyo lubog yung mata, payat sila. Okay? Or depende sa tao. Okay? May drugs kasi na kapag itinake mo, it's either mamamayat ka or mananaba ka. So, ang pagtitake ng dangerous drugs ay hiyangan lang din. Next, pag sinabi naman nating physiological, ito yung physiological kasi is the normal function of living things. Okay? Functions ng katawan mo. Okay? Bale, itong drugs na alter niya or nakokontrol niya yung reaction ng substance dun sa katawan mo. For example, nagtake ka ng drugs and then nagkaroon ng allergic reaction sa'yo. Okay? Allergic reactions like pamamantal or pamumula, yung patches na red sa skin. So, that is an example of psychological change sa katawan ng nagtitake ng dangerous drugs. Next, we have behavioral. So, pag naman behavioral, dyan yung nagbabago yung moods mo. Okay? Behavior. Pag-uugali mo. A person taking dangerous drugs, sometimes they are so aggressive. Okay? 'Di ba? Ang daming cases in which persons taking drugs, hindi na nila alam kung ano yung ginagawa nila. Okay? May nagwawala. May instances na nakakapatay sila dahil hindi na nila alam kung ano yung kinikilos or kung ano yung behavior nila doon sa kanilang normal behavior. Tapos, we have this psychological change. Okay? Pag sinabi nating psychological change naman, ito yung ina-alter or kinokontrol ng effects ng drugs yung pag-iisip ng isang tao. Okay? So, it alters the mindset and the brain of the person using the drugs. Okay? Next, we have medicine versus drug. So, ano ba yung pinagkaiba ng medicine sa drug? Okay? It says here that medicines are drugs, but not all drugs are medicine. Okay? Anong pinagkaiba nila? Okay. They are both cures for disease, but medicines are drugs. Pag sinabi nating medicines, ito yung mga gamot na non-addicting. Okay? Pag sinabi naman nating drugs, ito yung mga gamot na addicting and can cause withdrawal effects. Pag sinabi nating withdrawal effects, nandyan yung pwedeng, for example, magbabago yung mindset nung nag-take. Okay? A person taking shabu, marijuana. Okay? Iba yung level nung kanilang, halimbawa, alertness ba? Okay? A person taking marijuana, it says that yung mga nagtitake ng marijuana is tawa ng tawa. Sobrang saya kasi sobrang high nila. Okay? May mga drugs naman na nakakaantok. Okay? Kumbaga yung mga drugs na pampatulog. Okay? Pag sinabi nating medicine drugs, sila yung mga prescribed by the doctors. Okay? Medicine and drugs. And then, example naman, between medicine and drugs, halimbawa, morphine. If morphine is administered to patient with cancer to reduce pain, it is called medicine. Okay? Why? Kasi meron tong, although drugs si morphine, meron siyang prescription ng doctor and meron siyang proper dosage na kailangan lang i-intake ni patient. Okay? Pag sinabi naman nating drugs when taken without the right dose and without any clinical problem. Okay, ikaw, nag-take ka ng morphine. Wala, gusto mo lang. Wala ka namang sakit, wala kang prescription ng doktor. Okay, and then si morphine, itinake mo siya without the right dose. So, marami. Siyempre, pag nag-abuse ka naman ng drugs, hindi naman pwedeng paunti-unti. Okay? Hindi mo naman, for example, is morphine. Hindi ka naman magte-take ng morphine kung hindi sapat sa'yo or kung hindi mo pa na-attain yung high na sinasabi. Pag sinabi nating high, yan yung nawawala na sa tao yung ulirat. Okay? Dahil sa pagtitake niya ng drugs. Kumbaga, hindi niya na makontrol yung sarili niyang emosyon tsaka behavior. Okay? Next naman, we have, okay, dun muna tayo sa medicinal drugs. So, what are these medicinal drugs? Substance which, when taken into human body, cures illness and relieves signs and symptoms of disease. Okay. Tulad nung sinabi ko kanina, medicinal drugs are prescribed by doctors. Okay? Or, yes, pwedeng hindi prescribed by doctors. We call these medicines as over-the-counter drugs or over-the-counter medicines. Sila yung mga medicines na pwede mong bilhin sa drugstore or sa tindahan na pwedeng walang prescription ng doktor. Okay? Halimbawa, masakit ang ulo mo, pibili ka ng Biogesic, Bioflu, medical sa tindahan, pwede yon. But, yung mga antibiotics, amoxicillin, hindi ka nila pagbibilhan if wala kang prescription ng doktor. Okay? Medicinal drugs can cure illness. So, nakakapagpagaling ng sakit. Relieve signs and symptoms of disease. So, cures disease nga. Tapos, these are the medical uses of drugs. Okay, first, we have analgesics. Pag sinabi nating analgesics, these are drugs that relieves pain but produce effects on somebody who suffers from peptic ulcer or gastric ulcer. Example of analgesics is Biogesic, mefenamic acid. So, pag sinabi nating analgesic, ito yung mga gamot na nakakapagpawala ng sakit. For example, masakit yung ulo mo. Okay? Masakit yung puson mo. Pwede tayo mag-take ng analgesics. But, per person who suffers peptic ulcer or gastric ulcer, hindi advisable ang analgesics kasi magkakaroon ng magkakaroon ng side effects dun sa person taking it. Okay? Next, we have these antibiotics. Pag sinabi naman nating antibiotics, ito yung mga nagko-combat or nagpapatigil ng mga infections sa katawan. Okay, itong si antibiotic, ito yung sinasabi ko sa inyo na hindi basta-basta mabibili sa tindahan. Okay? Hindi siya pwedeng i-over the counter because kailangan niya ng prescription from the doctor. Okay? Why? Kasi, itong si antibiotics can cause allergic reaction and resistance to the drug. Okay, antibiotics, kapag ikaw ay napasobra nito, it can cause you side effects. Diba? Prescriptions ng doctors if you're taking antibiotics, meron diyang 7 days or 14 days lang. Okay? Nakikita nyo naman siguro yun sa mga prescription ng doktor. For example, take 1 per day for 14 days. Take 1 per day for 7 days. So, depende sa lala ng sakit mo, yung irereseta sa'yo ng doktor. Or depende if yung sakit mo ba, ano ba yung intent, okay, or extent dun sa gamot na ibibigay sa'yo. Another thing sa antibiotics is iba-iba sila ng milligrams. May 500 milligrams, may 100 milligrams. So, depende dun sa naging sakit mo, yung ibibigay sa'yo ng doktor. Kaya itong antibiotics, hindi siya mabibili basta-basta sa drugstore or sa mga tindahan. Next naman, we have antipyretics. Pag sinabi naman nating antipyretics, okay, from the word pyro, fire, mainit. Okay, pyretics can lower body temperature or fever due to infection. Ito naman, antipyretics is involved yung nagkaroon ka kasi ng infection, kaya ka nagkakaroon ng mataas na lagnat. So, itong sa antipyretics, okay, intended siya for infections and then mataas kasi yung lagnat mo. Okay, halimbawa, meron kang infection and then nilagnat ka. Possible na hindi ka basta-basta tabla ng regular or common na analgesics. Okay? Halimbawa, biogesic. Diba ang biogesic is intended to lower the pain and to reduce fever din. So, iba pa din yung dosage ng antipyretics. Next, we have antihistamines. Pag sinabi naman nating antihistamines, ito yung gamot sa mga allergies. Okay? It can combat allergic reactions. Okay? Kaso, itong si antihistamine can cause drowsiness to the user. Pag sinabi nating drowsiness, nakakaantok. Okay? Nakaka-low ng activity ng ating katawan. Next naman, contraceptives. Pag sinabi natin contraceptives, ito yung drugs na nakakapigil para magbuntis ang isang babae. Okay? Nagpe-prevent ng releasing of egg cells from the ovary. So, contraceptives. Contraceptives is for girls. There are some instances na ang contraceptives ay ginagawang gamot. For example, meron kang PCOS. Okay? Binibigay ng mga obstetrician ang contraceptives if ikaw ay may PCOS. Pero depende yun. Case-to-case basis ang pagbibigay. Okay? Halimbawa, there are cases kasi na kapag ang babae may PCOS, minsan hindi siya nireregla. Or minsan sobra yung regla. Kaya binibigyan sila ng contraceptives. Meron din, for example, ikaw ay bisexual or tomboy. Pwede kang prescribe ba ng doktor ng contraceptive para makontrol yung hormones mo. Okay? Next, we have this decongestants. Pag sinabi naman nating decongestants, congestion. Okay? Relieves congestion of the nasal passages. Pag sinabi nating congestion of the nasal passages, nasal, ito yung sa ilong. Okay? Pagbabara ng ilong due to sipon. Okay? Sinuses. Pamamaga ng sinus. Okay? Ito yung mga drugs na decongestants. Next, we have expectorants. Pag sinabi naman nating expectorants, ito yung mga gamot that can ease the expulsion of mucus and phlegm. Okay, ito, example of this is yung ambroxol, yung mga gamot sa ubo. Okay, paano ba yung expulsion? Diba, meron tayong gamot for dry cough. Okay, meron tayong gamot for phlegm. Kasi pag dry cough, syempre, kailangan mong mailabas yung mga plema. And then, meron din naman tayong gamot sa ubo na they are exclusive only para mawala yung mga plema sa loob. So, iba-iba yon kapag gamot sa ubo. Okay? Next naman, laxative. Pag naman sinabi nating laxatives, ito yung pampatae, kumbaga. Kung ikaw ay nag-LBM, you can take laxatives para ma-enhance yung pagpupo mo. Example of these laxatives na natural is yung papaya. Diba yung papaya, when taken it, maya-maya, magsi-CR ka na. So, those are examples of laxative. Tapos, example din ng laxatives is yung suppositories. Yung mga gamot na nilalagay sa puwet. Okay, yung maliit na parang gel na matigas, tas ilalagay sa puwet mo to encourage your bowel movement or yung pagtae mo. Okay, kasi pag nagtitibi, bukod sa tubig, kailangan mo samahan yan ng laxatives. It's either gamot or natural, yung mga prutas that are rich in fibers. Next naman, sedative and tranquilizers. Okay, ito yung nagpapakalma sa nerves ng isang tao without causing depression and clouding of mind. Okay, pampakalma, sedatives. For example, nasa ospital, there are instances that patients are very aggressive. So, kailangan nila ng pampakalma. Okay, bakit? Siyempre, para hindi sila magwala. For example, nasa ospital ka, nagwawala ka ng nagwawala. Oras mo na para mag-take ng medicine mo. So, kailangan, kung hindi ka kakalma in your way, lalagyan ka nila ng sedatives. Okay? Sedatives, usually, inilalagay yan or ini-inject yan dun sa dextrose sa patient. Kasi nga, sedative, tapos, kung yan ay sedative, tapos tablet, nagwawala nga yung patient, hindi mo ganun kadali mai-administer sa kanya kasi nga, nagwawala siya. So, paano mo siya paiinumin? So, ang ginagawa, and usually nga, ini-inject doon sa dextrose. Siguro naman, nakakita na kayo ng dextrose, tsaka kung paano lagyan ng gamot using the dextrose. Next, ito naman yung vitamins. Pag sinabi nating vitamins, ito yung mga supplements, substances which are necessary for normal growth and development and proper functioning of the body. So, ito yung mga food supplements na kailangan ng katawan natin kapag tayo ay kulang sa vitamina. Okay? For example, ang vitamins ay yung Enervon, Myra E, yung mga ganon, vitamins. Ay pang-enhance ng development ng katawan. Next, ito naman yung dangerous drugs. So, we have, diba, medicine and drugs. So, we have now the dangerous drugs. Okay? Pag sinabi nating dangerous drugs, affects the central nervous system when taken into human body and brings out physical, emotional, behavioral, and physiological changes sa isang tao. Okay? So, si dangerous drugs when taken, automatically will bring out the physical, emotional, and behavioral changes sa isang tao. Okay? Kasi, bakit ba nagtatake ng drugs ang isang tao? Okay? It's either, bukod dun sa pagka-addict niya sa drugs, meron siyang problema. Okay? It's either emotional or behavioral. So, pag sinabi nating dangerous drugs, ito yung mga ipinagbabawal na gamot. Next, we have drug abuse. Okay, when we say drug abuse naman, non-medical use of drugs that cause physical, psychological, legal, economic, or social damage to the user or to people affected by the user's behavior. Okay, when you are abusing drug, hindi lang itong tatlong ito, si physical, psychological, and behavioral systems of your body is affected. Kasama din dyan yung legal, economic, or social effects doon sa nagtitake ng drugs. Why? Why economic? Okay? Drug abuse is so expensive. Hindi mo naman pwedeng hingiin yung shabu. yung morphine. Hindi siya nahihingi. Okay, halimbawa naman is yung marijuana. Okay? Hindi ka naman pwedeng maging plantito or magplantita ng marijuana sa bahay mo. Kasi, syempre, marijuana is pinagbabawal na drugs din. Okay? Hindi ka pwede magtanim sa likuran mo. Okay? Sa likod bahay nyo ng marijuana. Okay? Mahuhuli ka ng mga pulis. Kaso ka, kulong ka. Kaya ang nangyayari ngayon, marijuana, trade, ginagawa nila, illegal. Okay? Unlike dati, marijuana kasi can be used as medicine. Dati. Okay? Kumbaga, marijuana, pwede mo siyang itanim sa bakuran nyo, hindi ka huhulihin ng tao. Kasi dati, hindi pa uso yung pag-aabuso sa mga drugs. Okay? Drug abuse then refers to illegal drugs. So, syempre, hindi ka naman mag-aabuso ng gamot na tulad ng biogesic at medical. So, para saan yun? Hindi ka mapapatay nun or hindi ma-alter nun yung pag-iisip mo. Kumbaga, wala kang high. Hindi ka ma-high sa biogesic. Okay? Next. Okay, eto na tayo sa classification of drugs. So, we have 4. Classification of drugs according to origin. So, saan ba sila nagmula? Internal classification, pharmacological effects. When we say pharmacological effects, nandyan yung hallucinogen, depressant, stimulants. Tapos, ito namang legal classification, bibigyan ko kayo ng pahapyaw dun sa batas related to drugs. Okay? Okay, according to origin, we have dalawa. The natural drugs and the synthetic drugs. Dun muna tayo sa natural drugs. So, pag sinabi nating natural drugs, these are active ingredients. Okay, pag sinabi nating active ingredients, sila yung mga ingredients na nakukuha sa halaman. Okay, hindi siya yung pinaprocess sa laboratory. Active ingredients, natural. Okay? Secondary metabolic products of plants. Okay? Plants and other living systems that may be isolated by extraction. Okay? So, plants. Tapos, i-extract mo, it's either yung bunga niya or yung dagta niya. Examples of these plants is the opium, marijuana, and the coca bush. These are the examples. Okay? First picture here, itong mukhang bola na may flower sa ulo. This is the opium poppy plant. So, ang kinukuha dito is yung dagta niya. Okay? Yung dagta. Ayan. Before siya ma-process as drugs, ito yung pinaka main ingredient niya, yung dagta. Okay? Kailangan ipaiyakin mo siya. Okay, kung sa papaya, papaiyakin mo para lumabas yung dagta. Okay? Ito, dadagta. Next, we have this, marijuana. Okay, si marijuana, lahat halos ng parts niyan is nagagamit. And pwede mo siyang gamitin in so many processes. Pwede siyang i-extract, gagawin mo siyang juice. Pwede mo siyang gawing sigarilyo. Okay? Tapos, ito yung example ng coca bush. Ang cute, di ba? Mukhang sili. Ayan, sorry. Ayan, yung coca bush. Cocaines. So, itong mga drugs na to, ma-encounter nyo pa to kapag nandun na talaga kayo sa subject ng drug education and vice control. Parang itong ginagawa natin ay slight discussion lang para kapag nandun na tayo sa examination of drugs, makaka-jibe kayo. Okay? Next, we have synthetic drugs. Pag sinabi naman nating synthetic are artificially produced substance. So, these drugs is yung drugs na ipinaprocess sa mga synthesized laboratory. Okay? Laboratory for illicit market, which are almost wholly manufactured from chemical compounds in illicit laboratory. So, ito yung mga chemical compounds. Kumbaga, for example, is the shabu. Okay? Bago siya maging shabu, madami siyang process na gagawin. Okay? Andyan yung mag-e-extract ka ng kung ano-anong chemicals. Okay? Chemical compounds. And then, it is made doon sa illicit laboratories. Pag sinabi nating illicit, it means illegal. Okay? So, hindi mo naman siya pwedeng gawing shabu. Halimbawa, sa ordinary laboratory, hindi pwede. Ito yung mga laboratory na kasama sila sa black market. Okay? Examples are methamphetamine hydrochloride. Itong methamphetamine hydrochloride, it is also known as the shabu. Okay? And the barbiturates. Barbiturates is pangmayaman na shabu. Okay? Pangmayaman, ibig sabihin, mas mahal siya kaysa sa shabu. Okay? Ito yung example ng shabu. Okay? Ito yung first example ng shabu. Ito yung shabu. So, shabu, meron tayong actual specimen dito sa school. Ipapakita ko na lang sa inyo pag tayo ay nagkaroon na ng online interaction. Okay? Next, we have the second one. Internal classification, we have dalawa din. Narcotics substance and the psychotropic substance. Okay, pag sinabi nating narcotics substance, ano ba ibig sabihin nun? Any drug that produces sleep or stupor and also relieves pain. Okay, nakakahina ng ating katawan or nakakatamlay. Okay, it depresses the central nervous system to produce a marked reduction in sensitivity to pain. So, itong narcotics na to, ginagamit yan para mais yung sakit na nararamdaman ng isang tao or ng isang patient. Okay, kumbaga, pasok dito yung tranquilizers, sedatives. Okay? To create drowsiness. Okay? Parang kasama din sa narcotic substance yung anesthesia. Okay? Pubunutan ka. I-injekan ka muna ng anesthesia para hindi mo ramdam yung sakit. Okay? Another, it is a drug which therapeutic doses diminishes the awareness of sensory impulse, especially in pain. O, ayun nga. Si narcotic substance, pampatanggal ng sakit. Okay? Para hindi nyo maramdaman yung sakit. Kapag halimbawa, may process na nagagawin sa inyo o operahan kayo, bubunutan kayo ng ngipin. Hindi nyo masyadong mararamdaman yung sakit. Okay? Pag sinabi mo din, narcotics, babawasan lang niya yung sakit is pain. Hindi necessary na mawawala talaga yung sakit. Kumbaga, nandyan pa din, nararamdaman mo pa din yung sakit, pero hindi ganun ka-intense. Next naman, psychotropic substance. Okay? Natural or synthetic that have high potential for dependence and abuse. Okay? Itong mga drugs na to, yung mga highly addictive but remain in medical use ngayon. Okay? Examples, heroin, marijuana, morphine, and cocaine. So, si marijuana, yes, it is addictive, pero ginagamit yan sa ibang bansa na panggamot. Okay? Kaya, sila na-approve for medicines kasi meron silang prescription from the doctor. Dito din naman sa Philippines, ginagamit ang marijuana. Okay? Pero with prescription of doctor. Okay? Itong si morphine naman, ginagamit yan dati kapag may war. Okay? Diba, ang soldier, kapag natamaan niya ng bala or ng kung ano man, okay, ini-inject nila yun ng morphine para hindi masyadong maramdaman nung sundalo yung sobrang sakit. Yan yun. Tapos, we have the last one, which is the designer drugs. Pag naman sinabi nating designer drugs, ito yung mga chemically related to but slightly different from controlled substances. Okay, pag sinabi nating controlled substances kasi, these are drugs na totally banned or totally na kapag ginamit mo is masyadong obvious. For example nga is dun sa shabu. Kasi shabu, ang pag-intake kasi niyan, inhalation, injection. Okay? Itong mga designer drugs, ang example niyan is yung ecstasy. Okay? Pag sinabi nating ecstasy, it is party drugs. Ang itsura ng party drugs para lang mga balgesic. Kumbaga, hindi sila masyadong halata na i-intake compared to other controlled substance like shabu and morphine, cocaine. Okay? Marijuana. Okay? How to use the marijuana? Siyempre, ini-smoke. Okay? Tapos, itong si designer drugs, it is designed by clandestine chemists. When we say clandestine chemists, these are chemists na secretly gumagawa ng mga drugs. Okay? That produce the high or euphoria apparent drugs and avoid penalties that would be levied against those illegally trafficking the controlled substances. Pag sinabi nating euphoria, ay ito yung sobrang saya or extensive happiness. Okay, yung baga high na high. Kayo sa klase, pag sobrang iingay, okay, yung euphoria ninyo sobrang taas, napaka-high. Okay, kaya naman sinabing avoid penalties kasi nga, itong mga clandestine chemists, dinidesign nila yung kanilang drugs na hindi masyadong halata in form of tablets. Okay? Mamaya, may examples ng mga designer drugs. Tapos, we have pharmacological classifications. We have 4. Stimulant, hallucinogen, depressant, and inhalants. Okay, first thing, we have the stimulants. So, ano ba yung ginagawa ng stimulants sa central nervous system? Stimulants speed up the messages to and from the brain. They can make the user feel more awake, alert, and confident. So, itong stimulants yung nagpapahay sa user ng drugs. Okay? Nagpapahay. Okay? Awake, alert, confident. Okay? Increase heart rate, body temperature, and blood pressure. So, kasi nga, ikaw, sobrang high mo, sobrang kulit mo, sobrang ligalig mo, automatically will increase your heart rate. So, pag masaya ka, sobrang saya ka ba, syempre, yung pintig ng puso mo, sobrang dami din or sobrang bilis din. As well as your blood pressure. Okay? Other effects include reduced appetite. Pag sinabi nating reduced appetite, wala kang ganang kumain. Dilated pupils naman, ito yung maliit yung black sa mata mo. Dilated pupils. Talkativeness, sobrang daldal, agitation, and sleep disturbance. Ito namang sleep disturbance, when you're taking stimulant, hindi ka makakatulog kasi nga sobrang alert and awake ikaw. Okay? Examples ay ito. Ephedrine, caffeine. Caffeine is found on coffees, tea. Okay? Diba, ang kape, ang tea, nakakawala nga sila ng antok. Nicotine are found in cigarettes, tobaccos. Okay? Amphetamine, methamphetamine, hydrochloride or shabu, cocaine or ecstasy. Okay. These are example of caffeine, nicotine. This is the shabu. Okay? Tapos, itong madaming tablets na to, ito yung mga designer drugs. This is an example of ecstasy. So, itong mga, di ba iba-iba yung itsura nila, may iba-iba't uri din sila ng pagkahay. Okay? Sa bawat design, may iba-ibang uri or, paano ba to? Iba-ibang level ng highness nung gagamit. Depende yan sa shapes and design. Kaya nga sila tinawag na designer drugs. Hindi sila madaling ma-procure or mahuli. Unlike this one na shabu. Hindi mo siya pwedeng basta-basta i-intake sa public. Okay? Ito namang mga designer drugs na to, usually nga, it is called the party drugs. Ito yung ginagamit kapag nagdi-disco-disco. Okay? Next naman, second one is the hallucinogens. So, ano namang ambag ng hallucinogen sa pharmacological classification ng drugs? So, ito namang si hallucinogen can cause subjective changes saan? Sa perception, sa thought, emotion, and consciousness yung gumagamit. So, itong hallucinogen, pwedeng yung tao is nagdideliryo na. Kasi nga, pinapaltan or ina-alter ng drug ng hallucinogen yung pag-iisip, emotion, and consciousness ng tao. Okay? People who have taken them may believe that they see or hear things. Ito yung nagdideliryo. Example, di naman kasi kayo nagtatrake ng drugs. Nag-hallucinate kayo pag sobrang taas ng lagnat, kung ano-ano yung nakikita. Okay? Kung ano-ano yung tinuturo, pati yung hibla ng kumot. Meron yang ganyan pag sobrang taas ng lagnat, nag-hallucinate. Alam nyo naman siguro kung paano mag-hallucinate. Okay? Nag-overreact on things that they see na hindi naman nakikita ng normal at walang sakit or hindi nagtitake ng hallucinogens. Next, we have effects ng hallucinogen. Ayan. Impossible to predict or how they affect a particular person at a particular time. So, itong si hallucinogen, iba-iba yung epekto sa bawat tao. Okay? Depende yan dun sa, kasi iba-iba naman ang level ng, tawag dito, iba-iba yung level ng kakayahan ng bawat katawan ng tao. May malakas, may mahina, may tinatablan agad, may hindi agad tinatablan. So, iba-iba. Depende sa tao. Okay? Ito yung mga examples ng hallucinogen. Ecstasy ulit. LSD. Lysergic acid diethylamide, or it is the most powerful psychedelic. Okay? Please take note that psychedelic means hallucination. Kung gusto mo mag-hallucinate ng sobra-sobra, mag-take ka ng LSD. Joke lang. Next, we have marijuana. Itong marijuana naman, it can cause sobrang happiness, extend happiness. Okay? Tapos, angel's dust or phencyclidine and the magic mushroom. Pag sinabi nating magic mushroom, ang ina-alter naman niya is yung mood. Nagbabago yung mood ng tao and nagkakaroon ng hallucination sa iba't ibang colors and shapes na nakikita nung taker ng hallucinogen. Ayan, ito yung magic mushroom, marijuana, ecstasy. Okay? Next, we have the depressants. Pag sinabi naman nating depressant, it is the counterpart ng stimulants. Diba si stimulants can cause highness, ito naman can cause down. Okay?